I want to start by saying thanks for being here. You know, this is a fascinating conference. I've had a look at the work that you will be doing over the next couple of days. I think the questions you will be wrestling with are exactly the right questions. I think that the learning that will come out of this will absolutely inform our government as we move forward. You know, Anne talked about the Excellent Care for All legislation and how we really are turning our full attention to improving the quality of care and getting better value for money when it comes to our healthcare system. You see, for Canadians, our universal healthcare system is something we hold very, very dear to us. It's part of our identity as a nation, our healthcare system. But as a demographer, I look forward and I see, holy smokes, if we don't start doing things differently, that universal healthcare system that provides such enormous peace of mind for all of us is in jeopardy. We cannot continue to do what we have always done, because if we do that, our system will collapse. It is not sustainable unless we change how we do things. So that's why the focus on improving quality of care is so vitally important, because, as I'm sure you know, poor quality care is actually very expensive care, because if people get an infection in a hospital, the cost of looking after that infection and all that goes with it is far greater than the cost of actually preventing the infection in the first place. When you've got people being discharged from hospital and then being readmitted within days or weeks, that too tells us there's something wrong with the quality of care, and the cost of actually caring for them when they return is greater than the cost of making sure they have the right supports as they leave hospital. So focusing on quality is the right thing for the system, and of course it's the right thing for patients, because nobody wants to be in a hospital more often than they have to be there. So we really do need to focus on quality. The other big piece is focus on evidence. And I think one of the questions you're going to be wrestling with is, how actually do we determine the evidence? We are very clear in saying there are things that we fund now that don't improve outcomes according to the evidence for people, so we're not going to fund them anymore. And there are things that we don't fund that we should fund because they do improve outcomes. But the whole issue of how do you actually generate that evidence? How do you know if what you are, if the medical device that you are championing, how do we make sure we are capturing the cost and the benefit of that innovation? I think is something that government has to learn how to do differently, and you're going to help us. You're going to help us do that. I am enormously optimistic that if we all work together, if all our brains are operating on all cylinders, and we are actually embracing change and embrace innovation, we will be able to pass on a universal healthcare system to our children and to our grandchildren. But I really do think that there is an important challenge we must all rise to, and that is all about how do we do things differently, because we must. So I'm very excited about this conference. I'm very excited about the exchange that you're going to have. I'm enormously excited about the economic impact of what is in this room today, if we all work together, what we're going to be able to do in terms of job creation. Ontario is, I think, perfectly positioned to be a global leader in when it comes to medical devices. There is no reason at all that we can't really capitalize on the extraordinary research that happens here, our wonderful, wonderful healthcare system, and all the brilliant people who work within it. So, as I say, I'm excited. I very much look forward to hearing what some of your recommendations are as we move forward. What I can tell you is there is an enormous appetite for the kind of innovation that you are driving. So let's work together. government, the health sector, the researchers, the innovators, the practitioners, all of us, I think, if we start working together, see the opportunity, respond to the opportunity, we will drive better patient care, we will have a more sustainable healthcare system, and we'll have new jobs for people in Ontario. And if I can be a bit parochial, but this is London, I think London is extremely well positioned to really capitalize on this as well. So all the best to you. You're doing something very important. I want to say thank you to Anne and the Ivey School of Business for spearheading this conference. I think there is much to learn. Thank you.